The senator from Illinois is very generous, and I thank him for it. But I would remind him that he was the persistent agent for the change in support for regenerative medicine. That wasn't easy to do, and he has been the leader, along with others of us who cared about the same thing, on making sure the United States maintains its lead in supercomputing in competition around the world. Now, Mr. President, Senator Murphy, the senator from Connecticut, is coming. I think what I will do is begin, and when he comes, I'll stop and let him make his 5 minutes of remarks, and then resume, so I don't delay the vote, because I know everyone's looking forward to casting a great big yes vote in a few minutes. Mr. President, the United States Senate Majority Leader, whose position in the Senate this is, has said more than once in private meetings where I was and on the floor of this body that the 21st Century Cures bill, on which we will be voting in a few minutes, is the most important legislation Congress will pass this year. In his address to the nation this past weekend, President Obama urged us to vote for the bill today and tomorrow. It could help us find a cure for Alzheimer's, the president said. It could end cancer as we know it and help those seeking treatment for opioid addiction. The president continued, it's an opportunity to save lives and an opportunity we just can't miss. Vice President Biden has been telephoning senators, urging support for 21st Century Cures, because in the Vice President's words, it's a big step for cancer research and the cancer moonshot that's so close to his heart. Speaker Paul Ryan in the House of Representatives has made 21st Century Cures explicitly a centerpiece of his vision for our country's future, describing it as, quote, bipartisan legislation that would accelerate the discovery, development, and delivery of life-saving treatments, unquote. With such bipartisan support from the President of the United States, the Vice President of the United States, the Speaker of the House, the Senate Majority Leader, 2 Democrats, 2 Republicans, it's no wonder that on last Wednesday, the House of Representatives approved 21st Century Cures by the overwhelming vote of 392 to 26. This legislation holds the promise of improving the life and health of virtually every family in the country. It will provide $4.8 billion in a one-time surge of funding for biomedical research at a time of breathtaking opportunity. It will advance Vice President Biden's cancer moonshot to find cures for cancer and President Obama's precision medicine initiative, as well as the BRAIN initiative. It will help move safe and effective treatments and cures through the development and regulatory process more rapidly and at a lower cost, making medicines available sooner and hopefully also at lower cost to patients. It will provide $1 billion in grants to help deal with the raging opioid epidemic. It includes legislation to help the 1 in 5 adults in this country suffering from a mental illness, to help them receive treatment by updating many of our country's mental health programs for the first time in a decade. It will improve health information technology for doctors who are eager to get rid of the over-documentation of hospitals and their patients and help get the nation's electronic health record system out of the ditch. And from a taxpayer's point of view, it does all of these things in a fiscally responsible way by reducing other spending to pay for every penny of the $6.3 billion cost. Mr. President, I see the senator from Connecticut on the floor, so I'd like to suspend my remarks for 5 minutes so that he can make his, and then I would ask consent that the totality of my remarks follow his remarks. And before he speaks, let me just say once again how much I appreciate his leadership and that of Senator Cassidy and that of Senator Cornyn. One reason why the Majority Leader calls this the most important piece of legislation Congress will act on this year is because it includes the mental health legislation that these senators, Senator Murphy, Senator Cornyn, and Senator Cassidy, have offered.
President. From Tennessee.
I thank the senator for Connecticut for his words and support for his effective leadership this year, and I thank also Senator Murray, the senator from Washington, D.C. She would be here, except her plane's late, and the vote will be held open to make sure she can be here. But Senator Murray is a member of the Democratic leadership, well respected on that side of the aisle, but also on this side of the aisle, because when she can, she creates an environment where we can do today exactly what we're doing today. And I think the American people appreciate that, and Senator Murphy and I both benefited from that. So thank you for those remarks. I'll now continue my remarks. At a Senate hearing earlier this year, Dr. Francis Collins, the distinguished head of the National Institutes of Health, an agency he calls the National Institutes of Hope, offered bold predictions about major advances to expect in the next 10 years from sustained investments in biomedical research, such as we're doing with this bill. One prediction is that scientists will find ways to identify individuals at risk for Alzheimer's even before symptoms appear, as well as how to slow or even prevent the disease. Today, Alzheimer's causes untold family grief and costs $236 billion a year. Left unchecked, the cost in 2050 would be more than our nation spends on national defense. Dr. Collins' other predictions are equally breathtaking. Using stem cells, doctors could use a patient's own cells to rebuild his or her heart. This personalized rebuild heart, Dr. Collins said, would make transplant waiting lists and anti-rejection drugs obsolete. He expects development of an artificial pancreas to help diabetes patients by tracking blood glucose levels and creating precise doses of insulin. He says a Zika vaccine should be widely available by 2018, with a universal flu vaccine and an HIV/AIDS vaccine available within the decade. To relieve suffering and death with the epidemic of opioid addiction that led to 28,000 overdose deaths in America in 2014, he predicts new, non-addictive medicines to manage pain, an even more effective antidote than the $1 billion that we would be authorizing by our votes today. These truly would be miracles. The bill has taken more than 2 years to assemble, both in the Senate and the House. There have been major differences of opinion, but the resolution of those differences, thanks to Senator Murray and to many other senators, has been bipartisan every step of the way. We saw that on display in the work of the President, the Vice President, the Speaker of the House, and the Senate Majority Leader. We saw it in the House with its vote of 392 to 26 last week, thanks especially to the leadership of Chairman Upton, Ranking Member Pallone, and Representative DeGette. And we saw it in our Senate Health Committee, where we approved 19 bills that include 50 proposals, and every one with both a Democratic and Republican sponsor, except for one bill offered solely by Senator Murray, who's the ranking Democratic member of our committee. Now, we have a diverse committee of 22 members. That would be an understatement, actually. Some of the most liberal members and some of the most conservative members. But when our committee considered these 19 bills during 3 markups held over several months, the largest number of votes against any one of these 19 bipartisan bills was 2. Let me say that again. The largest number of votes, recorded votes, against any one of these 19 bipartisan bills was 2 in our committee of 22. Here's what some of those 19 bipartisan bills approved unanimously or by a wide margin would do to help move safe and effective treatments and cures more rapidly through the regulatory process and into doctors' medicine cabinets and into doctors' offices. For example, Senators Bennett and Warren and Byrne Hatch would allow researchers to use their own data from previously approved therapies when they submit for review a treatment or cure for a serious genetic disease like Duchenne's, a rare kind of muscular dystrophy that can impact children as young as 3. Senators Burr and Franken will help to bring innovative medical devices such as artificial knees, insulin pumps, heart stents to patients more quickly by getting rid of unnecessary burdens in medical device evaluations and streamlining the review process for clinical trials. Senators Baldwin and Collins have had a bill to improve opportunities for our young researchers, essential to advancing biomedical research. Senator Kirk just talked about his legislation with Bennett, Hatch, Murkowski, Isaacson, Collins to improve rehabilitation research, helping the approximately 800,000 Americans who suffer a stroke each year. Senators Isaacson, Murphy, Casey, Wicker, and Vitter will help advance our understanding of neurological diseases. Senator Murray, as I mentioned earlier, will clarify that the FDA requires cleaning and validation data for reusable medical devices. Senators Murray, Hatch, Bennett, Cassidy, and Whitehouse, their bill improved health information technology for doctors and patients. We had 6 hearings on medical information technology. The program's in a ditch. We think we're helping to get it out of the ditch. We've been working with the Obama administration to do that, and I look forward to working with the Trump administration to continue that. Senator Burr, Bennett, Hatch, Donnelly would speed safe breakthrough devices, putting senior people in charge of the review process. Casey, Isaacson, Brown, and Kirk, legislation for if you're a parent of a child with a rare disease like brain cancer, their bill would increase the likelihood your child would be able to take a drug that will help by giving a drug company that develops a drug for such a disease a voucher they can keep or sell that will speed up the review of another drug. Now, one may say, this is getting boring. This is too long. It's not boring to the millions of Americans who stand to benefit from this. And it's exactly the kind of work that we ought to be doing in the United States Senate and what the American people would like to see us do more of. The medical electronic data technology, Senators Bennett and Hatch and many others interested in that. Burr and Casey and Isaacson and Roberts have important legislation for planning ahead for events like bioterror attacks to help protect against anthrax, for example, or smallpox. The Combination Products Innovation Act, a number of senators are involved with that on the committee. It will help prevent the growing field of combination products like Band-Aids with neosporin built in, or a heart stent that can be implanted to also deliver blood thinners to prevent clots from being caught in red tape. Then there is legislation that will give patients and their families a voice in drug development. There is one that is a top priority for the heads of FDA and NIH, will help those agencies attract and keep the kind of talent they need to approve all these exciting advances that are coming. There is legislation to shorten the development of new treatments to help those infected with life-threatening superbugs. The Advancing Precision Medicine, which Senator Murray and I co-sponsored, is in direct support of President Obama's initiative to map 1 million genomes so researchers can develop treatments and cures tailored to a patient's genome. There are 3 or 4 other major pieces of legislation, actually 5 or 6 others that I will include in the record but not read at this time because we're approaching the time for a vote. But let me conclude by saying that in addition to these bipartisan policies, the 21st Century Cures Bill includes $6.3 billion in funding. We usually don't attach such funding to a bill authorizing programs. We usually work along 2 tracks. One track for authorizing programs, one deciding how much to spend on those programs. During the last 2 years, while we've been working on our authorizing legislation, our appropriations committees have recommended major increases in support for biomedical research. It's important that every senator know this. In the current year, at the urging of Senators Blunt and Senator Murray, Congress added $2 billion a year to the $32 billion budget of the National Institutes of Health, which could total $20 billion over 10 years. Then the Senate Appropriations Committee recommended another $2 billion increase for the next fiscal year, 2017, which could total another $20 billion over 10 years. Now, this 21st Century Cures legislation adds $4.8 billion in a surge of one-time spending for the National Institutes of Health on top of the regular appropriated money toward key objectives. $1.8 billion for the cancer moonshot, $1.4 billion for precision medicine, $1.6 billion for the BRAIN Initiative. It adds $1 billion for state grants to help states fight the opioid abuse epidemic. I believe in every state represented by a senator here tonight, the opioid epidemic is on the front pages of the newspapers. It adds $500 million for the Food and Drug Administration. 21st Century Cures also gives the National Institutes of Health $30 billion for clinical trials to support regenerative medicine, which the Mayo Clinic has described as a game-changing area of medicine with the potential to fully heal damaged tissues and organs, offering solutions and hope for people who have conditions that today are totally beyond repair. It gives the FDA authority to allow regenerative therapies to be eligible for FDA's existing accelerated drug approval pathway. I want to acknowledge the work of Speaker Ryan and Leader McConnell in designing a way to secure funding that both Democrats and Republicans can accept. That's not always easy. For those concerned about additional spending, often on our side of the aisle, Speaker Ryan and House Budget Chairman Tom Price made sure that the funding is one-time, not mandatory, paid for, and approved each year by appropriations committees. It doesn't add one penny to the overall budget because for every increase in the discretionary budget, we reduce the same amount in the mandatory ledger. For those who worry that Congress might not approve the $6.3 billion in additional spending in later years, and I've heard a little of that from the other side of the aisle, my answer is that the best way to ensure that the money is spent in the following years is a big vote today and tomorrow when we finally pass the bill, just the House did last week. In conclusion, Mr. President, it will be hard to explain why you voted to spend $6.3 billion for cancer, precision medicine, and opioids this year, but then voted not to spend it next year. And the legislation provides that the money can't be diverted for any other purpose than what we vote for today and tomorrow. In addition, this year's portion of Cures includes $500 million for opioid grants is included in the continuing resolution that we will vote on later this week. This is the kind of lasting legacy, Mr. President, that the President of the United States and our Congress can be proud of. The next administration or the next Congress will not be repealing this law because we've taken the time to work out our differences and create a consensus of support. We did this at this time last year with an equally complicated bill to fix No Child Left Behind, which, despite its complexities, received 85 votes in this body. When he signed it, the President called it a Christmas miracle. Well, the 21st Century Cures bill will present President Obama with another Christmas miracle, one that will help virtually every family. And when we pass this legislation, the real winners will be the American families whose lives will be improved by this bipartisan legislation.